Let's talk about unexplained infertility. You've had your evaluation by your physician. You've done the basics. They all came out normal. The semen analysis is normal. You are ovulating, and your tubes, or at least one tube, is open. Then what to do? You're frustrated because there's no explanation. You're asking yourself, should we do fertility pills? Should we do insemination? Should we do in vitro? What to do? This is frustrating, and we recognize that, we as physicians, reproductive endocrinologists, and infertility specialists like myself. So there are recommendations of treatment that take into account time to pregnancy in terms of accelerating the time that you'll get pregnant. So let's discuss the American Society for Reproductive Medicine recommendations, fairly recent, about what to do in case of unexplained infertility. Should we use fertility medications, oral fertility medications, injectables? Should we go directly to IVF? Should we do inseminations? So here it goes. If you have unexplained infertility, oral medications to stimulate the ovaries, what we call ovarian stimulation, either with clomiphene, Clomid, or with letrozole, Femara, are appropriate, but only when combined with artificial insemination, what we call IUI, intrauterine inseminations, not alone. Alone, those fertility pills are not more effective than no pills at all or expectant management, meaning doing nothing. Use of the injectables combined with intercourse or insemination is not recommended anymore. It's expensive, it has risks, especially multiple births and ovarian hyperstimulation. So we do not recommend an interim step between oral pills, oral medications, and in vitro fertilization. So 3 to 4 cycles of oral medications, whether it's clomiphene or letrozole, and then going directly to IVF. That is now the recommended treatment for unexplained infertility. Of course, it can be modified after you discuss it with your physician, depending on your level of anxiety, access to in vitro, etc. Obviously, in mandated states, it's easier to move on directly to IVF, but it's not inappropriate to give you 3 to 4 cycles of oral medications combined with inseminations, and then consider in vitro fertilization. And that's the party line at this point.